Do you see a single puzzle or 1,000 possibilities? For every child or family we meet, we look at the details of their situation to piece together the best solution.
At just 7 years old, Tariq had been separated from his mom twice as she grappled with health issues. Despite a court order, it took 2.5 months before he saw a therapist. Without this critical support, Tariq struggled to understand and address the trauma that came from being separated from his mom and siblings. He worried about his future and began having behavioral problems at school and at home. Although he was only in the 1st grade, he was suspended for fighting. When a kid experiences this type of complex trauma, every hour, every day, every week matters.
Tariq wasn't the only child facing barriers in getting the care he needed. He's one of thousands of children we've met in our 25+ years who struggled to find the right behavioral health services to address their trauma. And when they did find the right program or therapist, the wait times were often unbearably long. We knew that when a child's behavioral health needs are addressed earlier and treated properly, they do better at home and in school, setting them up for success. Like addressing any systemic challenge, we needed to build a foundation for lasting change. We formed and led coalitions, raised awareness, convened allies across the community, brought our legal and advocacy expertise to the table, and built strong partnerships to make it happen. The J. Willard and Alice S. Marriott Foundation, the Bainham Family Foundation, the Howard and Geraldine Pollinger Family Foundation, and more stepped up to help over the past several years. Together, we've achieved many victories. Today, kids can access behavioral health services in every school, through their pediatrician in childcare centers. And we're also continuing to tackle much-needed funding, contractual, and regulatory changes.
Because of these long-term investments, thousands of kids like Tariq can get the care they need at the time they need it. And by removing these gaps, supports can be provided to the whole family, preventing kids from reaching a point of crisis.
Some of the students I meet as a school-based clinician have faced incredibly challenging moments in their young lives, including sexual abuse or traumatic death in their family. Anxiety and depression are consequences of these complex traumas. I've seen how, if untreated, they may lead to a variety of self-destructive behaviors, including feeling hopeless and wanting to die. Trauma can feel isolating and can impact a child's ability to form healthy relationships. With appropriate intervention, children are resilient and can heal and thrive. One of the best parts about my job is walking down the hall and reaching out to kids directly. Being back in school again has already been immensely beneficial. Kids are engaging with peers and staff who care, reducing their isolation, and supporting their healing. Students can easily be identified and connected to mental health treatment or seek support on site. And when kids can access the services they need at school, they tend to continue in treatment, build the skills to advocate for themselves, and flourish. School-based clinicians remove the extra hurdles that get in the way of a kid getting help before they harm themselves or others. And we're reducing the unbearable wait times. We're making sure kids know there's a trusted adult they turn to for help every day.
Ensuring kids have high-quality, timely, and culturally competent access to behavioral health care has always been a complex puzzle to solve, and the pandemic made this crisis worse overnight. Luckily, Children's Law Center has worked for years with our partners to lay a foundation that we can build on to get behavioral supports to more DC kids. Thanks to our supporters and partners, we've invested a lot and we've accomplished a lot, but there's more to do. Will you help us piece together the puzzles that lie ahead?